Hi friends, welcome to Solid Information channel. This channel contains a few videos on current affairs and history. Please check them out. Don't forget to subscribe and press the bell icon. Today we are in a very bad situation fighting against COVID-19 pandemic. We are also in a very grave situation where we have to fight against one more virtual enemy who is more dangerous compared to COVID-19. Yes, you guessed it right. It is depression. Depressive disorders erode quality of life, productivity in the workplace, and fulfillment of social and familial roles. Depression ranks third among disorders responsible for global disease burden. The symptoms of this disorder related to depression can be mild and very severe. They might include feeling sad or having a depressed mood, loss of interest or pleasure in the activities once enjoyed, changes in appetite, weight loss or gain, which is not related to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity or slowed movements and speech, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, finally, thoughts of death or suicide. What is psychotherapy? Psychotherapy is a talk therapy and it is sometimes used alone for treatment of mild depression. But in case of moderate or severe depression, psychotherapy is used along with antidepressant medications. Cognitive behavioral therapy. This is shortly called as CBT, and this CBT is a treatment wherein it is focusing on problem solving techniques and the present. So in CBT, people are helped to recognize distorted thinking and then change their behavior and also the thinking. Psychotherapy may involve only the individual or sometimes close family members. So for example, couple therapy can help address issues within these close relationships. Group therapy involves people with similar illnesses. So by doing this type of psychotherapy, the problem can be solved by 10 to 15 sessions itself. Electro-conclusive therapy is a medical treatment which is used for patients with severe major depression or bipolar disorder. I think you know what is bipolar disorder. Bipolar disorder means the patient or the person who has this disorder behaves very eccentric. When they are happy, they can't control their happiness, they just overwhelm, and when they are sad, they just go into very deep depression. So this is how they behave. They are not able to handle either fun or sadness in a good way. They become very eccentric. So these they are called as bipolar disorder patients. If a patient with bipolar disorder comes, then it is electroconclusive therapy which is given to them, which involves a brief electrical stimulation of the brain while the patient is under anesthesia. So when I say this, you already know that a psychiatrist is also accompanied by a physician in this kind of treatment, and this treatment is also existing from 1940s. So the best of all the treatments is nothing but self-help and coping. There are a number of things people can think about and which may reduce the symptoms of depression. For example, regular exercise, they create positive feeling, improvement in good mood, getting enough quality sleep on a regular basis might make you more healthy, and also eating regular diet and avoiding alcohol. Alcohol is a depressant, and therefore this may reduce the symptoms of depression. Depression is a real illness and help is always available. With proper diagnosis and treatment, the vast majority of people with depression will overcome. But today, why I took this topic is that we are the ones who are supposed to take care of our own self. We are the ones responsible for our mood swings. Whatever may be the reason, whether it may be the reason given by the doctors like our biochemistry in the brain or the genetics or the environmental factors, but we are grown-ups We have our own discipline, ethics, we have a sense of responsibility, we have a tradition, culture, so which all should make us better individuals, and we should get over all these kind of distractions, what I can say, and we have to recreate ourselves. We have to be more having more fun, and we should try to entertain ourselves, and we always have to keep ourselves occupied with some useful work, and better not indulge in any other unwanted activity or any other adverse behavior going ahead and affecting others' life. So it's better that you just focus on oneself, introspect yourself, and just think what is your need, what you want, and what is better for you. If you're growing fat and fat, just think what has gone wrong with you. Is it because of thyroid or any other hormonal imbalance, or is it because of lack of exercise, or is it because of you are becoming obese, or is it because of the abnormal food consumption? So everything is just in front of you. You have to just introspect yourself, and the best medication for depression is helping oneself. So today the situation of Sushant Singh Rajput, it has been discussed. We don't know whether it's a murder or it's a suicide, where he, due to depression, committed suicide. But on a very big basis, they are just claiming that he has committed a suicide. So not only Sushant Singh Rajput or anybody, even any common man who is in middle class, lower middle class, may be affected by depression. It is not meant to be only for the upper class people. Anyone can get depression. It is also not having any age limit or anything. So even a child can get a problem like this, depressive disorders. Even very old people or middle-aged people, young people, everybody can get this disorder. The only solution is self-introspection. We have been educated to lead a very disciplined, good, ethical life. So let us just think about ourselves, and why should we waste all our time and energy just sitting idle, depressed? So let us be happy and also make our loved ones happy. So with this note, I end this video. Thanks a lot for listening.